Hi, my name's Ruth Baxter and I'm a Senior Research Fellow in the Yorkshire Quality and Safety Research Group. I'm going to talk to you about an intervention we've developed to improve transitions of care for older people. The transition from hospital to home can be risky, particularly for older people with complex needs. 18% of older people are readmitted to hospital within 30 days, and around 30% of these are considered avoidable. 1 in 5 people have an adverse event following discharge, and many people report poor experiences. The Partners at Care Transitions research programme aims to improve the safety and experience of older people during this transition by supporting them to be more involved in their care. I'm going to talk to you about how we are trying to achieve this. So to develop our intervention, we drew upon data from 2 studies which explored patient and staff perspectives of transitions. The patient study involved interviewing and observing older people and their carers from admission through to 3 months post-discharge. The staff study involved focus groups and interviews with high-performing hospital, general practice and community teams. We combined these perspectives using the Functional Resonance Analysis method, or FRAM, to develop a theory of change as to how we might improve transitions. The FRAM helps describe how outcomes unfold within a complex system. It's used to describe work as done rather than work as imagined, and so aligns with the resilient healthcare or safety 2 approach. FRAM models consist of lots of these hexagons, each of which represents an activity or function of the system. By describing variability and how these activities are coupled together, you can explore how variation in one part of the system affects outcomes in another. So this is what our model looks like. I'm not going to go into detail, but just to point out there are activities that happen in the hospital and at the point of discharge, activities that are then conducted by the general practice and the community teams, and importantly for our work, activities that are completed by the patients themselves, often with the support of family or carers. So what are these activities that patients have responsibility for when they get home? Well, it's about understanding managing their health, managing their medications, completing their daily activities, and escalating their care if things don't quite go as planned. The FRAM model shows that on admission to hospital, patients tend to hand themselves over to the system, and the system also takes over responsibility for their care. So care happens to you, your medicines are managed for you, and you're encouraged to stay in your bed space, etc. Essentially, patients lose their autonomy. But then at discharge, this responsibility is really sharply handed back. And although staff hand over care to the appropriate services within the community, the handover to patients is often more brief and rushed. So in terms of supporting patients to do these 4 activities that they need to do when they get home, we need to strengthen this handover to patients. But our FRAM model showed that it isn't enough to do this near or at the point of discharge as we currently do. We also need to involve patients throughout their hospital stay so that they can prepare for being at home. By supporting them to know more and to do more whilst they're in hospital, they can either gain or maintain the skills and knowledge that they need to manage their care safely at home. So how is this theory of change different from existing transitions interventions? Well, the focus is on supporting patients during their hospital stay rather than at the point of discharge or the immediate post-discharge period. The theory of change recognises the need to truly involve patients rather than simply give them information. And it's one of the first studies to take a resilient healthcare approach or a safety 2 approach to improvement. So based on this theory of change, we co-designed the Your Care Needs You intervention. The intervention consists of 3 fixed patient-facing components. So a booklet that tells patients why they should be involved in their care, suggests how they might go about doing this, and provides questions that they might want to speak to staff about. The film provides call to action for people to be more involved in their care, and an advice sheet suggests what patients should do at home and where they should seek help from if they need it. However, we know patients are unlikely to be involved in their care without the support and encouragement of staff. Therefore, the intervention also consists of flexible staff-facing components. So based on their own contexts, wards decide what they want to do to support patient involvement. So that might include supporting patients to think about and ask questions of staff. It might include enhancing existing initiatives around MPJ paralysis or introducing, for example, chair-based exercise classes. Or it might support patients to take their own medications or to simply practice opening empty pill bottles so that they don't lose their manual dexterity during their stay. So what's next? Well, we've just started a cluster randomised control trial to test the effectiveness of this intervention across 40 wards and recruiting over 5,000 older people into the study. What we're hoping to do is reduce hospital readmission rates at 30, 60 and potentially 90 days, reduce adverse events and improve the experience of patients as they transition home. Thank you very much for listening. You can click on this link to find out more about the work that we're doing as part of this programme. Thank you.